This is Understanding and Implementing Telemedicine for Colorado Workers' Compensation Injury Care. I know that's a mouthful. It's pretty specific, but it's a specific topic. So my name is Nate Johnson. I'm the Director of Business Development for Workwell Occupational Medicine. I'll be your host for today's webinar. I wanted to start off by thanking all of you in attendance and go over some basic logistics. Again, I'll be recording this call. So you will receive a recorded session in your inbox within 24 hours of the end. You can ask questions. There's a Q&A. You should see, if you drag your cursor down by some of the options, you should see Q&A down there. You can also raise your hand at any time as well. Currently, I see that there's an Emily Schultz has her hand raised. She just lowered it. Fine. Great. But I want to kick it off. So let's move it along. I'm not going to speed through this, but I want to be conscious of your time as well. So on the call, we have a few people. I wish I looked like that right now. That after 5 weeks of work from home and barbershops closed in Colorado, my iPhone's having troubles recognizing my face even. So, but we have myself, Nate Johnson, Director of Business Development, CEO Steve Pottinger on the call. We have Paul Ogden, our Chief Medical Officer, and Judy Penato, Director of Operations. You can specifically point your questions to one of these panelists if you'd like, or you can just generally make this question. The Q&A will be at the end of the webinar. So we'll be able to answer those. And again, because of time, you can put your question in there. And if we don't get a chance to actually answer it, I'll have those answers in the email that I send of the recorded webinar as well. So with that, I'd like to pass it off to our CEO, Steve Pottinger.
Thanks, Nate. Hello to you all, and thank you for joining us today. For those of you who are not familiar with us, we are Workwell Occupational Medicine. We're the largest independent provider of 100% occupational medicine and workers' compensation injury care in the state. We currently have 6 locations and more coming soon along the Front Range. We've been getting so many requests for information about our telemedicine services that we thought a live webinar platform was an ideal way to introduce it, demonstrate it, and answer questions that you might have. But before I go any further, I just wanted to give a huge shout out to all of our Workwell employees for being so adaptive and compassionate and skilled in their care and their service to our patients and clients through this pandemic. So about 3 years ago, I challenged our management team to bring the concept of telemedicine to the occupational world. While it certainly wasn't new for our market space, the concept has been around for more than 20 years. In fact, in the early 90s, I worked at a small rural 30-bed hospital in Texas, where I wrote a grant to bring a live video feed from a large hospital system into the emergency room. Today, most healthcare plans offer free telemedicine benefits as well as live apps, and they're all commonplace now. However, workers' comp has been very slow to integrate this type of service into the real-world practice. So we've been spending about the last couple of years doing our homework, finding the right platform, developing best practices, and integrating telemedicine into our business model. We launched the service internally for our current patients in the 4th quarter of 2019. We anticipated a considerable time savings and convenience factor for our patients and clients. We began seeing increased service potential earlier this year for expanded services, the triaging of initial injuries, outreach and injury management services to rural parts of the state, and the ability to offer our specialist services remotely. And then when our state began to experience effects of the COVID-19, we immediately pivoted our patients to the new telemedicine platform, and we were able to continue to diagnose, manage, and treat those in need. We continue to serve our clients whose employees are injured on the job and are now also providing remote care to those with coronavirus exposures in the workplace. Um, our mission at Workwell has always been to provide expert care and comprehensive occupational medicine services to our clients in a unique and patient-centric way. While we will still need our brick and mortar locations to serve our clients and patients, we quickly realized the importance of providing this new type of service, and now telemedicine is part of our normal operations today and in the future. We certainly look forward to growing this part of our business and showing you today how Workwell's telemed services can easily be accessed by your business wherever you or your employees are located. With that, I do appreciate your attention and patience today, and I'll turn it over to Paul Ogden. He's our Chief Medical Officer and a physician in our Denver Northeast location.
Thanks, Steve. So I'd like to set the stage for my portion by speaking briefly about the regulatory world of telemedicine. The Colorado Medical Board set out policies in 2015 to address telehealth, and they have described telehealth as the practice of medicine using an electronic communication, information technology, or some other means of interaction between a healthcare provider in one location and a patient in another location. And there can be an intervening healthcare provider, but there doesn't need to be. Patients in one place, providers in another. It's pretty simple. The board does establish that patient-provider relationship exists even without an in-person encounter. And in Colorado, they also define the location of the patient as being where the event takes place. So the provider needs to be licensed in Colorado for the patient to be treated in Colorado. As Steve mentioned in previous slide, Workwell has been investigating and developing this product since 2017. So let's jump forward to our new world in 2020. Of course, coronavirus has turned our lives, our practices, our businesses upside down. Telemedicine is all over the news, and now we're hearing a lot about telehealth, telecommuting, everything. Of course, in the setting of a highly contagious disease, the advantages to telemedicine are just ideal. And it's a great way to manage patients that may have coronavirus, but also all the other conditions that we routinely take care of. And the biggest piece, of course, is the social distancing. With telemedicine, we can keep patients at a distance, protects the patients who have ongoing conditions that need to be physically present from exposures, and it also obviously keeps those who are ill or quarantined from having to be out and about to get evaluations. So telehealth is promoted by the governor, Colorado Department of Public Health and Environment, the Colorado Department of Healthcare Policy and Financing, which is the Medicaid folks, and of course the CDC has been actively promoting it as well. And in our regulatory world and workers' comp, of course, the division, workers' compensation in Colorado is a very strong, supportive division, but we want to make sure we align with their recommendations. They're encouraging telehealth as well during the pandemic, and they have set out that all medical decisions, including return to work, can be made via telehealth as long as the patient consents. They've had a couple of emergency rulings. One that specifically waives the requirement for patients to be seen by a physician by the third visit during a work comp case. We still think that that's important and try to make that our standard, that the third visit is with a physician. And then they also changed the requirement for authorization requests from 7 days to 35 days for the time to response. So success. We feel like telemedicine has been wildly successful. It's exceeded our expectations dramatically. We're finding we can accomplish about 70% of our visits via the telemedicine platform. And there's obviously the common sense things that you can't do. Well, I can't sew up a laceration via telemedicine. I can't explore a wound to look for a deep hidden tendon laceration or a retained foreign body. There's some things that just need to be done in person. Managing joint injuries, checking for loose joints, ACL tears, those kind of things, very difficult to do over a video audio link. But given that, we can still provide an awful lot of care. So from an important standpoint, we've been able to keep our clinics open. We've kept our workforce healthy and able to provide services in person. So as all of you know, frontline workers are still out there, healthcare workers, first responders, anybody in the food production distribution world, plumbers, electricians. There's an awful lot of people still working and they're getting hurt. Garden variety, lacerations, sprains, fractures that need medical care, and we're open so we can provide that. Part of the way is we've decreased the foot traffic in our clinic. So there's fewer people coming in and out, less chance of exposures, and we're able to still be here on the job providing care. In terms of the telemedicine, we're able to incorporate interpreters. The non-English speaking folks is a big part of the workforce, and we're able to handle that through the telemedicine platform. Case managers, of course, can join as well. We're keeping our coronavirus patients at home so that they're not out and about exposing folks, and we're keeping many of our healthy folks from having to come into the clinics as well. So we've added tele-PT now so that folks can continue the guidance in their rehabilitation without having to come into the clinic. We see patients all over the place, so they can be seen in their homes, in their work sites, cars. I've had patients do visits from the physical therapy office if they're getting remote physical therapy with the therapist, and the therapist is able to comment and maybe do some of the exam that I can't do over the video. Our providers mostly are in our clinics, but we have some providers who are working from home. We're using our standard electronic medical record, so all of our notes look the same, and we're able to maintain all of our documentation standards. We generate a 164 for every visit, and we've upgraded our ability to handle special forms, work status forms some employers require, Rule 6 letters, those kind of things we can do remotely if our providers are not in the office now. So all of this, it really has been dramatically successful. Nate, I'll turn it back to you.
Great. Thanks, Paul. For anybody that came on a little bit late there, again, our apologies, but I am Nate Johnson. I'm the Director of Business Development. In this slide, what I'd like to present to you is our branded telemedicine services, WWeCare. We want you to be familiar with this term because this is what you're going to hear from Workwell staff. You'll see on our website, social media, and all other advertising referencing our telemedicine service. So it's important to note that we will remain focused on exclusively occupational health services, and WWeCare will allow patients to connect to a Workwell provider anywhere within the state from their computer, iPad, or smartphone. And as you can see, the ideal patient for WWeCare are those with travel limitations, illness, or other restrictions preventing them to visit a clinic. Current example, of course, coronavirus exposure claims. But we're happy to announce that this service is currently available for initial visits, rechecks, even tele-PT visits, as Paul mentioned earlier. So on the next slide, the following slide, I'll go over the setup process for utilizing WWeCare. But first, let's take a look at some of the benefits. So it really breaks down into cost and convenience. So from a productivity standpoint, minimizing travel time, keeping people at work is great for productivity, especially if the employer pays for the travel time to and from appointments. But as far as expertise, this refers to the ability to connect to a provider who handles exclusively occupational health cases. So one who understands OSHA, the importance of keeping employees working or getting them back to work where appropriate. And as you can see, there's an abundance of convenience benefits with WWeCare. Access to quality care. This especially resonates with the rural employees and businesses. Have access to quality health provider from anywhere in Colorado. Save on travel time, huge convenience here, not just for the rural customer, but even traveling through Denver at the wrong time can be grueling. Access from home, work. In some cases, we've had truck drivers pull to the side of the road and initiate their visit. So really illustrating how easy it is. We have patients that work split shifts, making it difficult to find time to come into the clinic. Weather closures, this one's big. On average, we have about 5 either early or full closures due to weather. Now this becomes a non-issue. Lastly, you see daycare listed. Frequently, we have patients who bring their kids along to their clinic visit. The ability to conduct a visit from home in this case is not just a benefit to the patient, but also the clinic. So what's next? So before I turn it over to our Director of Operations, Judy Paynato, I want to discuss the process of connecting and conducting a visit. So I want to address what the process looks like for the employer to utilize WeCare in a work comp injury care setting. So if you're an existing client on this webinar, utilizing WeCare is actually pretty simple, and there's a good chance that your employees have already utilized this service if they've had a recent appointment. So we follow the same protocol from the profile we've already set up. Since we use the same electronic medical record system in the process, we did this for continuity between the telemedicine and in-clinic visits. We do, however, recommend adding telemedicine available next to the Workwell name on your ATP DMP list, just to let the employees know that that's also an option as well. But for new clients, also a very similar process to adding any designated medical provider to your list. So we take the relationship very seriously. We want to make sure that there's comfort, not just in our processes, but also the philosophy of care. So we start with a discovery call or meeting, and from there, we have a dedicated client services team that will create and customize the profile. We'll review it, and then simply you add Workwell to your designated medical provider list. And to dive deeper into the scheduling and appointment process, at this time, I'd like to hand it over to our Director of Operations, Judy Paynato.
Thank you, Nate. Dr. Ogden mentioned our success, and I would like to share some perspective on what that looks like. Since March 9th, we have conducted about 2,200 telemedicine visits. That's an average of 65 telemedicine visits per day across our 6 clinics. Those visits include a mix of new injuries, rechecks, and COVID-19 exposures and illnesses. We have executed successfully a dramatic change on our business operations. If you can just picture coming into any of our clinics, you walk in, you get greeted by our front office, then you sit in our waiting room for a few minutes and complete a medical questionnaire related to your injury. At that point, the medical assistant will bring you back to the exam room, review your record, and enter information into the medical record system. At that point, the doctor joins the examination. The provider will document your symptoms, create appropriate forms indicating your work status and treatment plan. Then you get walked back to the front desk to set up your next appointment. At that point, our staff will send all the documents to your employer, and if any referrals are made, our referrals department will follow up on that. As you can imagine, during this process, constant communication is critical between all of our staff. I'm happy to report that we have been able to establish that same level of communication through our telemedicine visits. We are able to communicate with our providers even if they're not in the clinic. And we're able to do it via email, phone, and an app called Teams. It's similar to instant messaging. Our staff has become skilled on helping patients connecting to telemedicine using phones, tablets, or computers. And in case something goes wrong with the visit, we have a protocol that we can move to a telephone call to take care of the patient. As Dr. Ogden mentioned, interpreters are critical for managing non-English speaking patients. Our system man assigns to each telemedicine visit an appointment code. That code is provided to the patient as well as the interpreter, and both parties can connect at the same time. But this process is not limited to interpreters. We have the ability to connect nurse case managers following the same process. To illustrate how easy it is, the scheduling and setting up appointments, this slide here really puts it into perspective. Our current process is calling to schedule an appointment, like you normally would calling your local Workwell clinic. And if a clinic is not located in your area, we have dedicated a number for scheduling appointments. Our front office specialist will gather the information, and schedule the visit. For WeCare, the patient will receive a text message and an email confirmation of their appointment, as well as a medical questionnaire. And this message can be either in English or Spanish. And if the patient is in clinic, our staff is happy to help them to download the app. That way it's easy for the patient to do so. But we will send a message with instructions as well. From there, it's easy as clicking on the text or email link to start the message, to start the visit. It is also important to note that they'll get multiple reminders, one a day prior to the appointment and 30 minutes prior to the appointment. And our no-show cancellation rates are less than 2% with WeCare. But let's move on to see what the visit looks like. That app is called Mend. This is what the workflow looks like from your phone. You will notice that the Workwell logo is through all the apps. You will simply click on the app from your smartphone, click Join Visit. You will enter the unique 6-digit appointment code, and you will find this on your text or email confirmation before the visit. I really like this slide here. What you're looking at is our virtual waiting room. We have customized this for the patient to join the visit. And during the development of WeCare, we focused not just on the convenience of the service, but we wanted the patient to feel comfortable while they were waiting to see one of our providers. Through this waiting room, they'll scroll through information regarding work on injuries, information about Workwell, and even trivia about Colorado. With that being said, our telemedicine platform allows us to monitor our wait times. And right now, our wait times are under 9 minutes. From the waiting room, our medical assistant will be the first person the patient will see. The medical assistant will go over all the medical questionnaires that the patient received via email. They'll review vitals, self-reported of course, like height and weight. Then the patient is going to be transferred to the provider, just like they were in one of our clinics. Once the provider joins the call, the provider can share their screen if needed, and they can also text information to the patient, and it's all HIPAA compliant. What we're seeing on the screen right now is the patient view. Once the provider creates the appropriate forms, indicates work status and treatment plan, the provider will transfer the patient to the front desk. We will set up follow-up appointments, and the M164 or work status is going to be emailed to the patient, password protected, and to the employer just if the patient was in the clinic. As an employer, you will not notice a difference. You will get the same paperwork. And with that being said, I'll open it up for questions at this time.
All right, thanks, Judy. And so there is a Q&A, so if you could use Q&A instead of chat for any questions that you may have. I just want a time check. Right now it's 11:52, so understandable if you need to break away. I get it. We will be answering all questions. We'll also be sending out the recording of this call, and you can also ask follow-up questions to us as well. But if you wanted to add any questions to the chat, you can do that now. You can also raise your hand. I could call on you and you could ask it verbally as well. So one question here is the cost of utilizing WeCare service. So really there's no cost to use WeCare service. We would still bill the same way as we would to Colorado fee schedule for any care setting, the same way as it would be in our clinic as well. So there's no additional service or cost to utilize WeCare service. Got a question here. Can the employer rep be included in the call? That might be a good one for Dr. Paul Ogden.
So the employer rep is somebody we have not included in the call because of the confidential nature of this. What we certainly are happy to do, of course, is to talk with employers after the call. And I think that probably at this point is the way we'll do it. I have not actually had an employer request to be involved in one of the telemedicine visits. Yeah, I think we would pick up the phone and talk with you afterwards like we normally do.
I have a hello. Would it be possible to get a quick summary of the first few minutes of the call? Again, I'll be sending out the recording of the call to be conscious of time. You'll definitely get the entire call in its entirety, so I'll make sure I do get that sent out. Can you talk about ability and limitations to use telehealth for impairment ratings?
That sounds like me, doesn't it, Nate?
Yeah.
So depending on the impairment rating, you might be able to do some of them on a telehealth platform. For instance, a mental health one would be fairly easy. Some things like post hernia surgery, we actually need to palpate for a defect in the surgical scar area, so that one would need an in-person. Measurements for range of motion is a big part of an awful lot of these. It would be hard to do those with any amount of accuracy over a video link. So I think there's a very limited ability to use these. The other piece where we might be able to coordinate, though, is you can have measurements done by a third-party provider if they're, for instance, a physical therapist who's appropriately trained, and we can use those ratings. So if we were doing a rural thing to avoid a person having to drive in, we could consider that part. But it would mean quite a bit of coordination between the physical therapist and the physician.
Great. Next question is, we give our employees a list of providers via email when there's a workers' comp incident. They choose what provider to go see. How will telemedicine work for employees' choice of providers? So I suppose I could take this one. So WeCare telemedicine, so Workwell, specifically in WeCare for the rural clients, can be listed as a designated medical provider. So our goal is to be able to offer occupational health services, specifically work comp injury care, to the four corners of Colorado. So we've been asked for years at this point from not just employers, but also large insurance carriers like Pinnacle to open up clinics in places like Sterling and on the Western Slope. And although that's not really in the vision of any time soon for Workwell, although we will be expanding our brand to brick and mortar, additional clinics, this is going to be our offering for rural locations. So it doesn't matter if you have a geographically relevant Workwell clinic nearby or not, you can list Workwell on your designated medical provider list. And then you would just, give them the number to call, just like you do any of your other providers. I hope that answered your question. Next question is, do you have a platform to perform virtual ergonomic assessments since many employees are working from home these days? So Workwell does have an ergonomist on staff, Scott Sullivan. We utilize him for job site assessments and FCEs. And currently he is conducting work from home ergonomic assessments. So that's information that in the next slide will be my email address. If you want more information of exactly how that works, please email me directly, and I'll get you connected and with all the information pertinent to do virtual ergonomic assessments, but the answer is yes there. What is included in telemedic evaluation for a COVID-19 exposure? So maybe Dr. Ogden talk about the process of managing the COVID exposures that we're doing currently.
Sure. So our telemedicine evaluation for COVID, of course, there's a number of steps that we need to walk through for that. Our first priority, of course, is try to make sure that the person does not need some type of an emergency evaluation. So we're looking for the severe symptoms, the shortness of breath, their ability to get up and walk around, those types of things that you would want to be sure that if they're staying home that are addressed. And then we look for causality. Causality sometimes is pretty easy it's like any work comp condition. Sometimes it's really easy, sometimes it's a head scratcher, and sometimes they fall in a gray area. So we want to know about dates of exposure. We want to know testing that they've had previously, if the person they were exposed to have been tested, all those types of things. And then we make a work evaluation. For most people that have an exposure, they get quarantined for 14 days to follow the CDC guidance. If they're in a work shortage area, first responder, or an area where you know, there's just not enough folks to go to work. If we quarantine everybody, those folks go to a symptom monitoring protocol for exposures. And then, of course, people who are ill need to be improved. And then depending on their job, it'll depend a little bit on how quickly we may send them back. Some employers have specific protocols and others follow CDC guidelines. So we try to align with those as much as we can.
Okay, next question. What would determine whether an in-person versus a telemedicine appointment is needed?
That's probably me also, Nate. So it depends quite a bit on the injury or the illness and what you're dealing with. Obviously, for the coronavirus, we're trying to do every one of those remotely. It keeps that person at home and not exposing others, and it keeps our workforce protected, and then the other patients that are in our clinics as well. So those ones, obviously, we're trying to do telemedicine for every single one of those. For the other ones, we're trying to do as many telemedicine as we can for the reasons we talked about before, the social distancing, keeping people from being out and about decreases the risk of exposure for everybody. But there's some things that we can do in person that you just need to do in person. So where you really need to do a good wound check to check for infection, it's a little hard to do that with the visual capabilities over the phone. There are times when you've done a couple of telemedicine visits for somebody and they're not improving. You need to get your hands back on, let's say it's a knee, and do a really solid knee exam again and see what's changed since you saw them initially. So it literally varies person to person. Some people, unfortunately, don't seem to have the skills to be able to pull off a telemedicine visit. Some don't have Wi-Fi or even decent cell coverage where they're at. Some don't have a smartphone or a computer. So there's a lot of reasons why we might need to do that in person.
Great. Only a couple questions left. And one is, can prescriptions be provided over the phone during a telehealth call?
Yes. Yeah. So we have mechanisms in place to do that. In general, we would write the prescription and fax it to the pharmacy or call it in to the person's pharmacy as the most straightforward way to do that.
Great. And last question is, can you go over the waiting room slide again, example of when it's used? So briefly, I'll kind of hit on that for you. So the waiting room slide is when you enter in a visit, so you enter that 6-digit unique code and you enter in, you're first going to see the waiting room. So it's a virtual waiting room. You can scroll down, you can, see things about common work comp injuries and, even trivia on Colorado. It's just something to kind of let somebody know that they are currently in a waiting room, similar to then when they're in a clinic. And the MA will then, when they come on to the call and claim that visit, then you'll get the two-way video. But I just wanted to go over that with you again. It happens every single time you enter into a visit. You're going to be in that virtual waiting room until the MA is there. They could be there by the time you get on as well, but it's used every single time. It's also used while you're being transferred from the MA to the provider as well, and also waiting to be checked out. One call came in. Can COVID-19 be considered a work comp claim?
Anybody? I guess I'll take that one. So yes, and it can be challenging sometimes to sort out exactly where the exposure happened, but we're certainly managing a lot of them. In the end, of course, it comes down to what the insurance company will choose to accept it as a claim. And we're still early in this process, but in good faith, we're certainly managing these cases that have been referred to us by the employers and doing our best to determine causality if we can.
All right. Well, that wraps up the questions. With that, I'll give the rest of your day back. Again, thank you so much for your flexibility. You'll be receiving a recording of this call. Feel free to distribute that amongst your team as necessary. My email address is right there. So feel free to reach out additional questions. If you'd like to see an actual live demo of WeCare telemedicine service, we like to just set you up as a patient. You can actually see what that experience looks like from start to finish. We love doing that as well. We appreciate you coming on. We're excited to continue on with WeCare telemedicine even post-COVID times, but keep an eye out for the email from me that'll have the recording and answers to all these questions, and feel free to reach out if there's anything else you need. Thank you so much for hopping on the webinar today.
Thanks, Nate.